Hi, I'm Dr. Amy Bend, and I wanted to talk about why it's so important for my patients to stay on track with their treatment programs. I practice chiropractic care in our practice. We utilize posture rehabilitation. We do X-ray images to determine postural distortions. We retrain our patients on how to correct their postural distortions. We also do what's called mirror image adjustments, and we use a technique called chiropractic biophysics. In addition to all the other techniques that we utilize, the chiropractic biophysics technique is the way we assess and analyze the overall outcome of our patients while still using our individual subluxation-based formulas. That being said, what we want to do and achieve with our patients is to not only reduce their pain and their symptoms, which is why most patients are in the office, is they're suffering, but we want to make a corrective change permanently so that I can not only get you feeling better while you're coming in, but teach you how to strengthen your body so that you don't need to be seen as often, because you're going to support the care with your corrective work. However, there is a minimum amount of effort that you should expect to put in, just like when you exercise, you learn, or you're training on how to do any skill, is you need to train the body and the neurosynaptic patterns that are coming from our brain to our vertebrae and then out to our extremities. So that being said, you need a certain amount of effort that you need me as a chiropractor to adjust your body, and then we want you to exercise or to stretch or to what we call mold your posture back into correction. Now, each person is going to have an individualized plan, but most people are going to need, no matter what, 3 days a week for at least 8 weeks, maybe 12 weeks, and then others are going to need another 12 weeks of 3 days a week based on how serious your symptoms are that you started with your care, how old you are, and how much degenerative joint diseases you have. But if you are just coming in when it hurts, and then you get one adjustment here, and then you come in 2 or 3 weeks and get another one there, or maybe you see me every 6 weeks and you know who you are, I get symptom management there. I'm not doing a posture correction. I'm not teaching you, and I'm not controlling and navigating your skeletal system into a corrective outcome. And that's harder for me to work with. So my A students are here. We give you a specific set of recommendations. You are doing your exercises either in the practice, but not only then, but I'd like you to see you doing them at home as well. You're on a rehab program of 3 adjustments a week, and then you're doing 5 days of posture work, and some of it's in the practice, some of it's at home, and then we're going to retest you at around 12 weeks, and we're going to re-x-ray you, and we're going to show you the results that you got. This is a great way for you to strategize and create outcomes, and it's a great way for me to actually get great results with my patients. And it holds me accountable, and I'm going to be observing you, and then it holds you accountable where you need to participate with your care, and we can as a team get you on a better place again. Now, there's always exceptions to the rules. There's people that have morphologies, there's people that have fusions and other issues that I'm not going to be able to get the same results with a person that's got a congenital anomaly with a fusion, or a person that's had their Harrington rods removed. Those patients are going to have more scar tissues than other patients, but I'm always open to what the possibilities are for your body to heal. I get surprised on what the body does sometimes, but we just go through methodically to create an outcome for you by taking x-rays and starting with a baseline, and then we can determine where you're at and what we can do with you. So what's great about our office is we do stress x-rays when needed, and we test. We test and we test and we test. So that being said, come in for your appointments, follow my recommendations, and you're going to experience the benefits of what chiropractic can do for you, rather than just coming in whenever you feel pain. You're not going to get a major outcome with that. Give me a call if you have any more questions about this. My number is 805-474-4747. My website's ArroyoGrandeChiropractic.com. Thanks for listening.